we are here in Georgia, where I practice, in a literal winter surge. Our numbers are incredibly high. And as you stated, across the United States, 200,000 kids in 1 week. And so that's the second week in a row that we've had these winter surge numbers, and Delta is twice as contagious. And so that's why when kids are back in school, it is so imperative that all of the prevention strategies that we know work need to be implemented for this to be safe. And so exactly what Dr. Hall was talking about, that it requires a multi-layer and a flexible approach to keeping kids in school if they're going to be safe. And so absolutely, I agree. Number one is definitely vaccination for all who are eligible, 12 years and up. And I would also say that the masking needs to be consistent and correct. I mean, we see kids in our clinics every day that have their masks underneath the nose. And it's, of course, not only our patients, the children, but also the adults. So it's a lot of instruction and positive reinforcement and messaging about making sure that the mask really is fit snugly and appropriately and sized to the child. And in addition, we definitely encourage schools to implement testing. Most kids who have COVID are going to have no symptoms at all, which is why access to testing is so crucial to our communities so that we can catch it before outbreaks really take off. And certainly we want to maximize the ventilation that's available in schools, whether they have updated their HVAC systems or even can open doors, put some windows down, and also, of course, good old-fashioned hand washing, cleaning and disinfecting high-touch surfaces, right? And one of the most crucial things is that if you are sick, if your child is sick, if it's a teacher, do not go to school. Please call your pediatrician, call your doctor, make sure that COVID gets ruled out before you go back to school. It's so important. And where a lot of kids may have a different virus, a different cold, we have to make sure that COVID is ruled out before you go back.